Do continue to learn more about COVID-19 and the Omicron variant. We know a lot more than we did in March of 2020, but the data still is not perfect. Our Liz Crawford talked to a USF professor about the 3 key metrics missing from the pandemic puzzle.
Since the beginning of this pandemic, there's been 3 metrics we're told researchers rely on: new cases, hospitalizations, and deaths. Now, Dr. Jason Salemi, who created this dashboard, said that hospitalization data is the most important.
Hospitalizations are kind of that Goldie Locks zone where it's an important indicator of severe illness and it's not so lagged from when cases are happening.
Dr. Jason Salemi's dashboard is intended to give people a visualization of COVID in our country in real time. He crunches daily data from the CDC, U.S. Department of Health and Human Services, and the Florida Department of Health. It's comprehensive, but he wants more information.
Right now, we're relying on a lot of recent information coming out of the UK.
He'd like to see data on these 3 factors: vaccination status of those being admitted to the hospital, prior infection status of those being admitted to the hospital, and reason for hospitalization, meaning are they in the hospital for COVID or another reason and they tested positive while there.
How much does a prior infection protect you? How much does vaccination and boosting protect you? And how many people is Omicron actually putting in the hospital? That's why these metrics would be really valuable to have at the national level.
Many hospitals already record this data. Jackson Health System, with hospitals in South Florida, publishes this information daily on Twitter. Thursday, more than half of their COVID-positive patients were admitted to the hospital primarily for non-COVID reasons.
That will allow us to do some more meaningful dives into the data and answer a lot of the questions that the public has been having.
Just yesterday, the CDC Director addressed this issue, saying the agency is making the best decisions it can based on imperfect, outdated data. Dr. Salemi is hopeful to see more data in the coming months.
And taking a deeper dive here tonight, information on which variants are circulating, that's also lagging. The CDC just published this look at the number of Omicron cases, showing here in the purple. It is 99% of what's circulating here in the southeast right now. But this was only through Christmas. The CDC says it takes 2 to 3 weeks from swab time to when the sequencing data is available for analysis. Another concern is the sample size. In Florida, researchers sequenced 4,800 of the cases that were detected. That is fewer than other states with much smaller populations. Also, the U.S. as a whole sequences far fewer cases compared to other countries, just over 2%. For some comparison, the U.K. is doing nearly 4 times that many, while in New Zealand, they sequence 7 times as many cases as the U.S.